Well, Tompkins County Whole Health released data spanning over 5 years regarding unintentional fatal overdoses. WENY's Alexander Duran spoke with the organization's commissioner about what the trends are showing from that data. Alexandra.
Renata, when we look at these trends, we can see demographic information about who exactly is dying from these unintentional drug overdoses over the last 5 years. Whole Health's Commissioner Frank Krupa tells me this data was compiled from medical examiner records over a 5-year span with a sample size of 100 individuals who accidentally overdosed and died. And again, this data focuses on those who are using drugs intentionally, but then they're accidentally dying because of that use. Krupa says other drug-related data includes people who intentionally overdose to commit suicide or they were drug-related car crashes. The data was compiled to show the Tompkins County community who exactly is being affected by drug use.
While it's 100 deaths, and that's way too many, it's still a relatively small number. So it is challenging to make any real significant statements of what the data necessarily means, but it begins to paint the picture.
Krupa says this kind of data will be able to help provide the community with solutions to combat the opioid epidemic with specific backgrounds and occupations.
Categories was food service. 22% of the deaths were working in food service at some point prior to their death. And so that tells us there's a place that, we have not been targeting locally that we should potentially be looking at. How do we communicate about the risks of drug use to those populations? So
Krupa told me Whole Health is preparing to enter phase 2 of this project. That's going to be collect overdose data that didn't result in death. But before that happens, they want to make sure that people who are intentionally taking drugs know the risks that come along with it. Renata.
All right, Alexander, thank you.